Early detection is key when it comes to saving the lives of cancer patients.
But for Black women, the numbers are grim. They're less likely to be diagnosed and more likely to die from the disease. And there's a number of factors experts say contribute to the deadly outcomes for Black women. This week, Keitha Nelson's taking a look at those reasons as she shares the untold truth.
Today, we're taking you to Atlanta, where you'll meet the lead scientist of a landmark study aiming to improve the health of Black women for generations to come. We're also delving into a candid conversation here at home in Jacksonville at a local salon.
Because for me, I want it from head to toe.
Yes. There are certain settings where women feel comfortable to share a laugh or two.
The way we grow up, our culture, we are not exposed to a lot of vegetables, especially our green leafy vegetables besides collard greens, right?
And speak the untold truth.
I've had over maybe about 3 clients that passed from cancer within the last 10 years.
A Bliss Styling Studio served as a safe space for these Black women to share their reasons, why they've decided to join the Voices movement.
All you can do is just cry. Like, how can I have been a part of a solution that helped save her?
Cynthia Meadows recently signed up for the Voices of Black Women research study being conducted by the American Cancer Society. At its helm, lead researchers Alpa Patel and Lauren McCullough.
There are certain things that we definitely know, like healthcare access is obviously important, and the Black population generally has poor access because of things like where they live, transportation, insurance, etc. We also know that they are diagnosed with more aggressive types of disease, which are going to lead to poorer outcomes naturally. And so that's something still as a research community we're trying to better understand.
For me recently, actually, I went to the ER and I was feeling pain, and because I was feeling pain, I was a little anxious, and so it felt like everyone that came in before the doctor was just chalking it up to an anxiety attack. But I really was in pain and there was something wrong. So the doctor listened, but everyone else didn't, and that wasn't the first time that has happened.
There's a ton of data that shows that Black women are often dismissed in healthcare settings, that their pain is typically ignored, and really being able to provide the evidence that exists and being able to provide ways and interventions to help mitigate that in our healthcare system is one of the goals of this study.
McCullough and Patel explained disparities in health outcomes are not limited to healthcare access.
Certain types of personal care products, chemical hair straighteners as one example, may put you at higher risk for certain types of cancer. But again, when you think about the way science and evidence is built, you need to have really robust data and evidence to be able to affect change, and we don't have that yet.
Any of you use chemical hair straighteners, anyone?
Yes.
I used to, yeah.
I stopped back in December.
Because?
Because my hair was falling out.
Sorry to say, clients now have to be educated because stylists now are doing it for the money, and you don't know.
The Food and Drug Administration proposed a ban on formaldehyde and formaldehyde-releasing chemicals in hair straighteners and relaxers in October of 2023. It was initially scheduled to take effect in April of 2024, but the FDA has since delayed implementing the ban and have not yet provided a new date, stating the rulemaking process takes time.
Products that are marketed towards Black women have those certain chemicals in it. And so now it actually has me thinking, I need to read the ingredients on everything. So even when I put certain lotions on my body, I'm careful not to put them on my breasts.
The Centers for Disease Control has recognized racism as the root cause of many health disparities. In April of 2021, the CDC declared racism a serious public health threat.
I don't think I fully understood the structural underpinnings of health outcomes for Black women until I found myself in that particular situation, where I wasn't given the care that I needed or deserved, despite being highly educated, despite having insurance, despite having access, simply because I was a brown face in a white system.
Dr. McCullough says it's important to take a look at the bigger systemic pieces that impact Black women day to day without them necessarily knowing it.
My experience at that hospital is an institutional racist experience. That racism is built into the institution of providing healthcare access. My personal experience is my personal experiences, but it's built within a larger construct.
Doctors Patel and McCullough have dubbed this first of its kind Voices study a movement that uplifts the voices of Black women everywhere.
I would say what I would want people to know is take ownership in your health, journal your health, because if you don't take that ownership, no one else will.
The American Cancer Society is calling on Black women from all walks of life to join this movement. Visit voices.cancer.org to see if you're eligible to enroll. It's understood that there is reluctance within the African American community to join research studies. Tomorrow, we're taking a look at why.